Thank you for your interest in prevention health screenings and for taking the time to learn about the company. This video will provide you with all the information you need to hire prevention health screenings with confidence. Now, before we begin, here's a word from company president Kevin Felmley.
Hello, and thank you for your interest in prevention health screenings. I am Kevin Felmley, company president. Our mission is to detect potentially life-threatening diseases and disabilities through prevention and education. Since our beginning in 2001, we have performed more than 1.1 million screenings. Over the next few minutes, you will learn more about prevention health screenings and how we help people take a more proactive role in their personal health. Again, thank you for taking time to review how beneficial our company can be to you, your employees, and your company's bottom line.
Our goal is to find a potential health issue early so the individual can receive the proper intervention by their physician. This allows a major health crisis to be avoided, as well as prevent a major insurance claim for the employer. That's one way our program can save you money. Furthermore, by preventing major insurance claims for such things as strokes and heart attacks, you will also save your company money by helping to lower health insurance costs. The services provided by prevention health screenings began because physicians are unable to order routine screenings for their patients. Take, for example, screening for an abdominal aortic aneurysm, or AAA, which you will see momentarily. This condition is highly hereditary, but physicians cannot screen their patients or even family members of those that have an aneurysm because insurance companies will not pay for it. Prevention health screenings makes health and wellness convenient for you, your employees, and organization members by bringing the screenings right to your site. We are mobile and can set up right at your company or headquarters. We're based in Harrisburg, Pennsylvania, and extend our services throughout Pennsylvania and communities in Maryland, Delaware, and West Virginia. Screenings are very affordable. Similar tests at a hospital or outpatient setting can run up to several $100s each. Our screenings are about $25 each or less. Prevention health screenings philosophy is to utilize the most advanced color flow ultrasound technology and employ the most experienced and highly skilled sonographers. These affordable health screenings can discover undetected health problems in individuals who are at risk for heart disease, stroke, pulmonary disease, and osteoporosis. Prevention Health Screenings believes in working in partnership with you and your doctor by making available to you a board-certified vascular physician to review and produce a written report on the results of your screening. You can take the written report to your physician for further consultation. Prevention Health Screenings program of preventative medical detection enables individuals to discover unknown medical conditions that most often can be treated before a major health crisis arises. This is our main goal. Our equipment is state-of-the-art, and the exact same equipment can be found in hospitals and imaging centers. Our mission is to provide the highest quality service possible at an affordable rate for anyone. The physicians who review each screening are specialists in their field. We use vascular surgeons with extensive experience in evaluating these types of studies. In addition, our physicians are from an ICAVL accredited vascular laboratory located in Camp Hill, Pennsylvania. This accreditation ensures that you will receive the highest level of experience from your screening evaluation. Let's take a look at the carotid artery screenings. This screening uses non-invasive ultrasound to check for the presence of plaque buildup in the internal carotid arteries, which could lead to a stroke. Carotid arteries are the highway for blood to enter the brain. That's why sometimes a stroke is referred to as a brain attack. Here are some important facts about strokes. Stroke is the #1 cause of nursing home admissions. Only 1/3 of stroke victims actually die from the stroke. A stroke will cost your employer an average of $45,000. 2 out of 3 stroke victims are not lucky enough to have a warning sign. Typically, blocked carotid arteries never show problematic symptoms until they are at least 80% blocked. And personal physicians cannot order a routine ultrasound test on someone that does not have any symptoms. This is where PHS comes in. During the screening, the technologist takes 2 very important measurements. First, she will visualize the artery to see if there's any plaque where the carotid artery splits. One artery, the external carotid artery, goes to the face and scalp, and the other, the internal carotid artery, goes to the brain. It is at this split where most plaque occurs, and the technologist will assess how much, if any, plaque is present. Second, the technologist measures the velocity or speed of the blood in the internal carotid artery. This is very important because, again, this is the artery that goes to the brain. The vascular physicians who read the screenings are really concerned about the velocities more so than the plaque characteristics. Usually, a little bit of plaque is not enough to disturb blood flow. By measuring the velocities, we know if the right amount of blood is flowing through those arteries, and it is the velocities that tell us if it is a normal or abnormal screening. Screening the thyroid is so important because 1 out of every 13 Americans have a thyroid disorder. Common symptoms of thyroid abnormalities can include fatigue, weight gain or loss, body temperature swings, and difficulty swallowing. Those symptoms sound like nothing much, but scanning the thyroid can determine if a disorder is present. With the use of an ultrasound, the technologist visualizes your thyroid gland for any nodules, enlargements, or general abnormalities. Abnormal thyroid glands should be followed up for further evaluation. The aorta is the largest blood vessel in the body. An abdominal aortic aneurysm, or AAA, affects the segment of the aorta that runs through the abdomen. AAA is common in older adults, and there appears to be a genetic link because this type of aneurysm tends to run in families. And people who smoke cigarettes are more likely to die from a ruptured abdominal aortic aneurysm than non-smokers. Abdominal aortic aneurysms usually occur in people with atherosclerosis, also known as hardening of the arteries. As the arteries harden, the wall of the aorta is damaged and weakened. The pressure of the blood flow inside the aorta causes the weakened wall to bulge outward. High blood pressure also contributes to weakened aortic walls. The rupture of an abdominal aortic aneurysm is now the 14th leading cause of death in the United States. It is estimated that 1.5 million people over the age of 60 have a AAA. In fact, once an abdominal aortic aneurysm has ruptured, 25% of patients die before reaching the hospital, with an overall operative mortality approaching 50%. But here's the good news. This condition can be identified in minutes with a painless ultrasound. The technologist will visualize the aorta vessel and take several measurements. If an aneurysm is present, the technologist will be able to see it very quickly. A normal aorta is about 2 centimeters, so anything over 3 centimeters is considered an aneurysm. An aneurysm that is over 5 centimeters will be considered dangerous, and surgery will most likely be required at this point. Known as the silent killer due to its typically asymptomatic development, the AAA often goes undiagnosed, leaving the patient vulnerable to a catastrophic, potentially lethal rupture. This screening checks the arteries in the legs for a disease called peripheral arterial disease. This is the same disease process that occurs in the carotid arteries and the heart coronary arteries. When someone has PAD, the blood flow in the legs becomes restricted. PAD is usually a precursor to heart attacks and strokes. The most common test to detect significant PAD in your legs is the ankle to brachial index, commonly referred to as the ABI. It is a Doppler blood pressure measurement comparing the blood pressures at the ankles to the arm blood pressures. Our ABI test takes less than 10 minutes. It is critical to detect PAD early because an abnormal ABI is linked to higher risk of heart disease. Atrial fibrillation, or AFib, is a condition when the heart rhythm is irregular. If left untreated, it could lead to a stroke. When your heart does not beat regularly, it can cause blood to back up into your heart. This can lead to the formation of blood clots, which could then travel to the brain, causing a stroke. This screening is performed by using an electrocardiogram. The leads are placed on the wrists and the lower legs without any removal of clothing. The heart rhythm measurement is then read by a board-certified physician to check to see if atrial fibrillation, or irregular heartbeat, is present. The EKG equipment used is the same that can be found in hospitals or medical clinics. Osteoporosis is a debilitating disease in which bones become fragile and are more likely to break. These breaks or fractures are usually found in the hip, spine, and wrist. Any bone can be affected, but of special concern are fractures of the hip and spine. A hip fracture almost always requires hospitalization and major surgery. It can impair a person's ability to walk unassisted and may cause prolonged or permanent disability, or even death. Spinal or vertebral fractures also have serious consequences, including loss of height, severe back pain, and deformity. People over the age of 50 are most at risk for osteoporosis. It can affect both men and women, usually as we grow older, but women are more likely to develop osteoporosis than men due to thinner, lighter bones and the decrease in estrogen production that occurs during menopause. Bone mineral density measurement, or BMD, is the most commonly used method to confirm a diagnosis of osteoporosis. Ultrasound measurements predict future fracture risk by measuring the BMD in the heel. Prevention Health Screenings utilizes the latest ultrasound technology for detection of bone mineral density. We use the Achilles Express ultrasonometer, the only unit approved by the FDA for detection of bone mineral density and monitoring results of therapy. The pulmonary function test is used to check for COPD, or chronic obstructive pulmonary disease. COPD is a lung disease in which the airways of the lungs become damaged or blocked, making it harder to breathe. It is a slow, progressive, chronic disease characterized by cough, sputum production, difficulty breathing, airflow limitation, and impaired gas exchange. Pulmonary function screening is performed by using a device called a spirometer. The spirometer measures important numbers such as lung volume, capacity, and dynamic measurements for the patient and their physician to help diagnose asthma and COPD. You are now informed of the many diseases which can be detected early, possibly prevented. And hopefully you now understand the importance of prevention, education, and early detection when it comes to your health and your employees' health. Most tests are about $25, and we can design a health screening plan for any budget. Prevention Health Screenings can work with your current health insurance company to add screenings to your current plan. Choose to make a difference in your company's bottom line while showing you care about the people who work for you. And don't just take our word for it. Here are a few people sharing why they use Prevention Health Screenings and how it made a difference in their life.
When they were looking with the ultrasound in my chest area, there was an indication that something was a little larger than it should have been, and it was my aorta. I met with Dr. Atnip 2 weeks later. He had the results, and based on what he saw, he recommended that I have an operation that would eventually save and prevent any rupture of my aorta. Afterwards, I realized how lucky I am that I'd had this testing done. If you value your employees, it'd be a good idea to nip any potential problems in the bud. The technology's here today, and we'd be foolish not to take advantage of it. And if they don't find anything, isn't that great?
We have an extensive and intensive wellness program here at Snyder's. We have for many years. And approximately 6 years ago, we became aware of prevention health screenings, which provided us an opportunity to do screenings for individuals as far as their vascular system is concerned, and their thyroids. And so we felt like it was a prime opportunity to be able to have individuals screened for conditions that otherwise were not picked up unless they had already had symptoms of a disease present. Through these particular health fairs, we've been able to find many employees who have had things as peripheral vascular disease, which is early, that we've been able to catch early. We've had carotid arterial disease present that was detected, and we've even had people with aneurysms, early pulmonary disease, as well as osteoporosis. They're very thankful for us providing this service. They have come to us and said they never knew that they'd had this particular problem present and that we had caught it early for them, and they are now healthier for having had that opportunity to be screened. I think that this has been a very positive influence on the employees. In fact, each time we have the health fair, we have more and more participants. Prevention health screenings has provided us with excellent service. They are here whenever we need them. We are a 24-hour, 7-day-a-week operation, and they have been more than willing to come in and provide excellent staff to perform the tests on our employees. So it's been very flexible as far as our particular industry is concerned. Prevention health screenings allows us to schedule patients in time slots that are very convenient for our production employees. It takes a very short period of time. They're not off the floor very long and are able to complete their testing process so that we don't really have a big interruption in production time at all. And the employees are happy about that, as well as management. From a company perspective, if we happen to find someone who has an early disease process, we are able to get them treatment, and the cost for that treatment is much less as opposed to letting that disease go on longer, which would cost us as a company much more money. It makes employees much more thankful that we found something before they became devastatingly ill, or there was some type of long-term disability that they ended up having to live with, including ones that could have possibly resulted in them being unable to work.
Normal family practice doesn't usually, provide these kinds of tests, so I thought it was something that would be good for my medical file. I was curious, and if something had come up, then perhaps there would be some prevention involved there, and I knew my doctor would want to know about it. Well, he was pleased, and he immediately asked for copies of the results, and so that he could have them for my medical file for present or future. Everything was normal, which was nice. The test proved that there were no problems. I was impressed with the process and the results. Sure, I see no reason why people shouldn't continue to want to know results of tests like that and show concern regardless of what the situation is with health care. I would see no reason why you would not want to do it. Anytime that you get positive results about your health, regardless of what it is, and particularly these extra screenings, it certainly is a positive effect and makes you feel much better about yourself and where you're going with it.
You may have a few questions for us, so let's see if some of our most frequently asked questions and answers will help.
We started our screening service in 2001 after many of our patients and their family members wanted to be checked for vascular disease. A physician cannot typically order an ultrasound evaluation on someone that does not have any symptoms for the disease. Also, Medicare and health insurances typically do not cover these types of screenings as part of a routine physical examination. That's why these screenings are so important. We are not trying to replace your personal physician in any way. We are simply trying to give him or her more information about you so they can make better decisions about your health care. That's a great question that we get asked frequently. When the signs and symptoms of vascular disease do appear, the disease is already in an advanced stage. Consider the following fact. Stroke is the third leading killer in the United States, and 2 out of 3 people who suffer a stroke have no symptoms prior to that stroke. The vast majority of people who have an abdominal aortic aneurysm have no symptoms whatsoever. The mortality rate for a ruptured aortic aneurysm approaches 90%. Peripheral vascular disease in the legs is closely linked to heart disease, and osteoporosis is a silent bone disease that can be detected, prevented, and treated if caught early. All screenings are done at your location. We are mobile, so we bring all necessary equipment and only require 1 or 2 tables and some chairs. We are proud to offer a screening service that uses registered vascular technologists with the American Registry of Diagnostic Medical Sonographers, the national credentialing body for ultrasound technologists. A board-certified vascular physician reads each screening before mailing them back to you. We use screening protocols that were developed in vascular laboratories and hospitals to ensure accuracy and consistency in the vascular screening process. Prevention Health Screenings utilizes state-of-the-art color duplex ultrasound technology and is the same as used in hospital and clinics. Diagnostic tests of the same type and using the same machines can range from $400 to $700 in the hospital setting. That's a good question. An overview will be given to you by the technologist at the time of the screening, and then a full written report will be sent to you in 10 to 14 days. No, after one of our physicians has reviewed the screenings, you would go to your own physician if further evaluation was suggested. If you have any additional questions about our services, please call us today. We're here for you.